Are there ways to prevent urinary incontinence in men?
There are lifestyle changes that we do, eating healthy, losing weight. Metabolic syndrome in itself is a risk factor for urge incontinence. And that's all related to diabetes and diabetic cystopathy, as we like to call it. In diabetes, the bladder first becomes overactive, and the overactive bladder causes leakage. And then eventually the bladder just stops squeezing completely. And then that's when those patients need a really cath. And then they are leaking because they're overflow. So there's two different leakages happening in that disease course. There was studies showing that patients undergoing bariatric surgery, those patients' urinary incontinence improves. Their lower urinary tract symptoms improve. So every 5% of the weight that you lose, the amount of leakage episodes decreases as well. Weight definitely plays a factor. There's also relation to stress incontinence as well. That's more so in women than men, but it shouldn't be neglected either. As you can imagine, the more weight that you have, the more intra-abdominal pressure that you're causing on the bladder to cause leakage, especially in men who are having structural issues. So everything's connected.